Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what sexual health is, sexual health in epilepsy, the side effects of anti-epileptic drugs, epilepsy in female sexuality, epilepsy in male sexuality, addressing side effects and protecting sexual health. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. According to the Centers for Disease Control and Prevention, sexual health is defined as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach when it comes to sexuality, relationships, and the possibility in having pleasurable and safe sexual experiences, free from coercion, discrimination, and violence. Individuals who have epilepsy can have a healthy sexual relationship with someone. There are individuals with epilepsy who may avoid intercourse in fear that they will have a seizure. Having a seizure during intercourse is not common. Sexual dysfunction can affect people who are battling epilepsy. For men, medication can reduce their testosterone levels, resulting in having little to no interest in having sex. For women, lack of sexual desire, lack of arousal, lack of orgasms, and sexual pain can be the result of anticonvulsant medication. People who have temporal lobe epilepsy are at higher risk for developing sexual dysfunction. It is important to practice safe sex and use contraceptive to prevent unwanted pregnancy. Some anticonvulsant medication can cause harm to the unborn fetus. If you are considering becoming pregnant, schedule an appointment with your neurologist and OB/GYN to see what your options are. Practicing safe sex is also important in preventing and getting sexually transmitted infections and sexually transmitted diseases. STIs and STDs can cause complications and severely impair the quality of life for the person battling epilepsy and in some cases be fatal. Anti-epileptic drugs, or AEDs, are frequently used to help control seizures caused by epilepsy and operate by altering the levels of chemicals in the brain. AEDs are the most common treatment for epilepsy, since it is challenging to develop drugs that target solely one part of the body. Medications often affect other functions, which causes side effects. Common side effects associated with using AEDs are drowsiness, nausea, mood change, irritability, blurred vision, and more. Side effects of anti-epileptic drugs can also interfere with more intimate parts of a person's life, such as their sexual health. Close to 50% of men and women with epilepsy experience sexual dysfunction, and often it is not discussed and goes unnoticed. Approximately 13% of epileptic patients have talked about sex and sexual health with their doctors. Whether this silence is fueled by fear or embarrassment, there is no shame in having these critical conversations. Women who live with epilepsy and take AEDs can experience infertility, sexual dysfunction, increased risk of congenital disabilities, osteoporosis, and more. Since anti-epileptic drugs treat seizures by changing the chemical levels in the brain, AEDs can adjust hormone release and disrupt or alter the metabolism of sex hormones. Female reproductive hormones such as estrogen and progesterone affect seizures because these hormones interact with the cells in the brain. While it is still unclear how sex hormones impact brain cells, the risk of convulsions increases through the production of estrogen. Lowered estrogen production can lead to sexual dysfunction in women, primarily vaginal atrophy and dyspareunia, which are side effects of AED treatment. Epileptic men who use AED treatment commonly experience sexual dysfunction, including erectile and ejaculatory dysfunction and lowered libido. Approximately a third of epileptic men will encounter this difficulty. The sex hormone binding globulin levels in men increase while testosterone decreases. This is believed to be associated with enzyme-inducing AEDs. Epilepsy itself may have the potential to cause disruptions in sexual health. People who are diagnosed with temporal lobe epilepsy have decreased genital blood flow in response to stimulation. The interruption between the limbic and frontal cortex caused by convulsions may be the cause. For epileptic men and women, anxiety and depression also contribute to poor sexual health. A well-rounded approach to providing symptomatic relief is imperative in these cases. It is best to speak with your doctor or neurologist to address any sexual or reproductive health issues caused by epilepsy or the medication used for treatment. Your neurologist can help advise you on the problems driven directly by your epilepsy. Lowering the effects of sexual dysfunction caused by AEDs can happen through spreading awareness and providing adequate education and training to care providers on sexual health. While it may be difficult for some to start conversations regarding sexual health with their providers, addressing and managing issues concerning your health is essential. In conclusion, according to the Centers for Disease Control and Prevention, sexual health is defined as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach when it comes to sexuality, relationships, and the possibility in having pleasurable and safe sexual experiences, free from coercion, discrimination, and violence. Common side effects associated with using anti-epileptic medications are drowsiness, nausea, mood change, irritability, blurred vision, and more. Side effects of anti-epileptic medications can also interfere with more intimate parts of a person's life, such as their sexual health. Both men and women can experience sexual dysfunction when taking anti-epileptic medication. It is best to consult with your physician if you are experiencing any problems. To learn more about the side effects of anti-epileptic medication and sexual health, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.